Hi, everybody. This time last year, October 29th, 2024, I was probably getting ready to come out of surgery I had a brain decompression surgery last year because I was finally diagnosed with Chiari malformation Chiari malformation 1, because there's different levels of it, and uh, syringomyelia, which is basically a cyst that forms in your spinal cord because of the Chiari malformation. And basically what that cyst is formed is because your cerebral spinal fluid can't flow correctly. So that's kind of, it goes through your brain and through your spinal cord, makes everything work, your nerves for your body and all that good stuff. So with mine, since I had the Chiari malformation, it cut that flow off. So the fluid had to go somewhere. So slowly and over time, it filled a cyst in the center of my spinal cord. And I didn't write down the exact location of it, but it ran basically my entire cervical and thoracic spine. So basically from the top of the spine to, past the middle of your back. Okay, there was a cyst. And at the widest part, it was, I believe it was 4 millimeters, which is pretty good size for being in the middle of your spinal cord. So the beginning of last year, I started really having more symptoms than I had my entire life. The Chiari malformation is something that you're basically born with. So I've had that malformation forever. I had terrible headaches as a teenager, and just never knew what it was. And I'm kind of glad that, nobody looked into it back then, because there's still so much information that is needed and so much research that's needed for this condition. I'm glad nobody tried to do anything, 30, 40 years ago. That's kind of scary to think about. But anyway, so I got the diagnosis in May, the first week of May, because I switched doctors, and I was telling him every time I would cough or sneeze, I would get an excruciating pain in my head, and I have a high pain tolerance anyway. But it was like I thought I was just gonna drop dead. Like, it was that bad. It was like you would sneeze and it would be the sharpest pain you can imagine. And I had an almost 10-pound baby, okay? Worse than that. Now, it didn't last. It would be like that terrible pain, like you're gonna die, and then it would fade away, okay? So, a lot of doctors they're not familiar with Chiari malformations and, the symptoms and all that. So, I kind of got blew off. It was, if the pain had stayed, then they may have sent me to get tests and stuff. Whatever, long story. But anyway, I switched doctors, and I was talking to my doctor about it, and he said, you know what, let's just send you for a CAT scan to rule things out, because I did have a family member that had a brain aneurysm. So that's kind of what I was afraid it was. He didn't think so, but he wanted to just rule anything out. So he sent me to get a CAT scan. I got a CAT scan that following week. And he called me the next morning, and he was like, did you know you had a Chiari malformation? And I was like, I don't even know what you're talking about. What is a Chiari malformation? What is that? So a lot of research, trying to find information, and they consider it a rare condition, but I really feel like it's more people have it than they realize, just because so many doctors don't know, they don't even think about it because they don't know about it. And the reason is a lot of the symptoms kind of could be so much of so many other things. It's a little crazy. So my little list of symptoms right here, just for an example, and this, a lot of this, besides the headaches and stuff, a lot of this really started in last January. Like, it really, like, hand numbness, arm numbness, like the right side of my body got really weak. At some points, like when I'd start walking, I swear I looked like I was about, 100 years old trying to hobble out of bed. It would take me a few steps to really get going. But it was just crazy, like weakness, heaviness on my right side. Just a lot of things. I would get face tingling, my eye would flutter, just so many things. Like when I would drink or eat something, I would constantly feel like it was getting stuck. So that's one of the things, it's a weird thing that all of these things are tied to this condition. It's just crazy. My vocal cords were like, I could feel them like vibrating, and my voice had gotten like rough sounding. Terrible vertigo, especially if I was driving. Like, I got scared to drive. I kind of stopped driving because it just terrified me. High anxiety level, and I'm not usually an anxious person, but very high anxiety. And I think a lot of it was due to the vertigo and things like that. Dizziness, balance issues, the coughing, my ears popping like an altitude thing, but I wasn't in any altitude. My heart beating and like a rush feeling, which I've had that since like 2012. And my doctor then put me on a beta blocker because they just couldn't find anything. And so they put me on a beta blocker, and I've been taking that ever since. So it could have been something I didn't need, but hello, here I am, still taking it. So, anyway, there's a lot of different things. And, all of these things could have been something else. But come to find out, the doctor sent me for that CAT scan, found out I had this condition. I went and I ended up having more MRIs and just all this testing. And that's when they found the Syrinx, is what they call the cyst in my spine. When you have those, a lot of people that have the Chiari malformations go on and live a life without having surgery. They don't need to get a decompression surgery unless they're really starting to have symptoms. With me, where I was having the symptoms and I had the Syrinx, when you have a Syrinx, you really have to get surgery, because that means the flow of your spinal fluid is just not getting where it needs to go. So I had to have it done. I ended up having it done October 29th of 24. So 1 year ago today, and right now I'm recording this, it's about 7:15, and I was probably coming out of surgery right about now. So once I got out of surgery, I was taken to the recovery room, and when the doctors came in, and the first thing they had me do was squeeze they talked to me, of course, and then they had me squeeze their hand. Well, when I squeezed his hand, now my doctor was Dr. Judy Huang at Johns Hopkins Bayview. Highly recommend. Fantastic. But another doctor came in, and he got me to squeeze his fingers, and I could feel myself squeezing his fingers, which was huge because I couldn't even really feel this hand before the surgery. It was crazy. So I instantly started crying and, all that stuff. They talk about how painful the surgery is, and it is a painful thing. Would I do it over again? 1,000,000 times. I would do it 1,000,000 times over. The pain is temporary. And I'm not a person, I do not, I don't like taking, hard painkillers, nothing like that. Once I left the hospital, which I had the surgery on the 29th, I left the hospital on November 1st. And so I was in like the intensive care for most of the time. But when I left, the only thing that I took after I left that hospital was Tylenol. That was it. One night I took, there was a muscle relaxer. I took one night, one pill, because my butt hurt so bad. And I've told this story on another video, so I'm not going to go into all that. But oh my gosh, get up and move. That is so huge if you have this surgery. Get up and move. I did not get up and move enough, and my body paid for it. It took the place of any pain I was having here because my butt hurt so bad. Oh my God. Anyway, so I took Tylenol and I used ice packs, and those ice packs saved my life. And I would, in probably a week and a half, I was, good to go. I still had like tenderness and some uncomfortableness, but nothing that Tylenol didn't take care of. And ice packs, those ice packs were golden. So definitely do that. If you are a person that's looking for information, because gosh, I looked for so much information. That's why I'm doing these videos. So anyway, this is what the surgery was. After looking at it, this is what they said, how they describe it. It's and I'm probably saying it wrong. I'm not a doctor, okay? I'm just the patient. Suboccipital craniectomy with a CI laminectomy and microdissection with expansile duroplasty, tonsillar cauterization, and cranioplasty. Okay, so basically what they do, they open the back of, and like now you can't even tell. You can't tell where the surgery was. Like you really have to look at it. It feels like it's indented a little bit, but you can't see it. But basically they open from the right at my hairline. I don't know. I'm probably not even seeing it on here. From my hairline up to about the crown of your head. That's where mine, that's how mine was opened. They open it. They take out a piece of bone. Most of the time, they're opening the dura, which is the covering of the brain that holds the fluids and all that stuff in there. They open mine with a Y-shaped cut. They spread the tonsils of the brain. So there's tonsils that come down from the bottom of your brain. And behind that, for my particular case, there was like a spider webbing adhesions, basically, is what my understanding was. So these spider webbings were so tight and thick for me. That's what was causing my like choking feeling, or the swallowing and all that, the vocal cord problem and all that. So they severed that, which loosened all of that up. They cauterized the bottom of my tonsils because they hung so low. The tonsils were pushing out the bottom of my brain into my spinal cord. So they cauterized those, which they, people argue about it all the time. They don't have a use. It doesn't hurt anything as far as your thinking, your thought process, any of that, for those to be cauterized. Okay, I've had mine cauterized and I think way better than I did before the surgery. So, let them keep arguing, whatever. So once they do that, then they put a patch in the dura to make it bigger, so there's more room for the spinal fluid. And then they close that up, of course. And then my surgeon, she actually created, it's a clear plastic plate or covering or something that covers where the bone was, and it's clear, so down the road, if I have to have some kind of imaging or something, they don't have to open my head. They can do the imaging right through that clear plastic. So it's something she invented. Fantastic. So they cover that. They screw it in with titanium screws. Close it up. They did take part of the C1 vertebrae, the back of that. They did take that off of mine. Let's see, what else did they do? Oh, and then the I guess the cranioplasty is where they just kind of shave out some of the bone from the inside and just kind of I guess make smooth edges or something, and then they cover it with that plate or whatever, the plastic, is how my neurosurgeon did it in Johns Hopkins, Baltimore. So, I have a lot of people that ask, well, how do you feel now? How are you doing? I am doing fantastic. Like, my thinking is clear, my speech is clear, and that was one of the things that, like, I would a lot of times fumble for words, which I did it so much that I just thought that's just what I did. But no, it had a lot to do with that condition. So I speak a lot clearly. I feel like my voice is really returning. It hasn't gotten 100%, but it still gets better all the time. Like, I'm actually singing in the car. You know, I just feel so much better. I have total movement. I feel all of my, you know, limbs. My fingers don't tingle. I'm walking like with balance. I can spin around. I was actually like kind of spinning, doing a bird thing in the yard with my granddaughter the other day. And the only time I really get dizzy is if I try to spin around. So that I still don't do a lot of spinning, you know, quickly, because I will get dizzy on that, but it's because I'm spinning in a circle. So no, you know, no vertigo, none of that stuff. My anxiety level has really gone down, especially driving and everything. I had gotten to the point it was almost like a panic when I would drive, and I'm getting a lot better with that. So yeah, so I am doing great. I'm so thankful that I went ahead and got the surgery. If you're, you know, still watching this and you're wondering if you should get surgery, my main tip is make sure you have a specialist. Oh my goodness. I had talked to a neurosurgeon locally, and she basically blew me off. And she was like, well, it's up to you if you have the surgery. Well, you know, had I just gone with that, who knows what I'd be. I might not even be able to walk now, you know, because if you have that syrinx, that cyst in your spine, that can cause nerve damage that, you know, sometimes that doesn't come back after the surgery. So especially if you have that syrinx, definitely get a specialist. Like I said, went to Johns Hopkins in Baltimore. They have a Chiari Malformation special unit. Every doctor there is great. I haven't heard a bad thing about anybody there. My particular neurosurgeon was Judy Huang, and I would recommend her a million times over. She's fantastic, very easy to understand, and doesn't fool around. She just tells it like it is. So I really liked her. And all the care that I got while I was there, highly recommend. They were fantastic. And for being able to, you know, live life fully again is just, it's just fantastic. So, anyway, I'm just gonna wrap that up. It's almost been 20 minutes. I'm sorry, this has been long, but I just wanted to give a 1-year update. And, yeah, so I'm doing great, and I hope you are too. And thanks for listening. All right, bye.